Good evening, ladies and gentlemen. My name is Bruce Doran. I'm one of the staff scientists that works at Science North, and thank you for joining us in our Fireside chat about the COVID-19 vaccine. So unfortunately, I don't have a fireside right here. You can just imagine. So it's a kind of a casual discussion, question period with a local expert about COVID-19 vaccines. So hopefully this session will be very informative to you. Before we begin, I'd like to do a land acknowledgement. So we would like to acknowledge that we're on the traditional and ancestral lands of the Atikamekw, Anishinaabe, and Wanapete First Nation. We would also like to acknowledge the Métis Nation of Ontario for their cultural and economic contribution to this area. These lands sit in the Robinson-Huron Treaty Area, and as we are all treaty people, it's important for us to think about the treaty area that we live in and that we are a part of. So let's take a moment to appreciate the land that we are on, and by acknowledging the traditional and ancestral territory and the treaty area that we are located in. So again, thank you very much for joining us. So I will be co-hosting this session with a local expert. So I'm co-hosting this with Dr. Natalie Goodale. So Natalie should be popping up. Hello, how's it going, Dr.
Good,
Goodale?
how are you?
Good. So you are a local physician, is that correct?
Yep, I'm a family physician at the City of Lakes Family Health Team in Sudbury.
Cool. So just so for our audience member know, just one more thing. I have another colleague, Renata. She's the technical wizard in the background. So if you have any questions during our discussion period, please write them down in the chat, and Dr. Goodale and I will do our best to answer your questions, because really we want to use this session to inform you about the vaccines so that you can make an informed decision for yourself and for your family. So this is really what it's all about. And what I've been doing is I've been collecting some of these questions I've been hearing in our community, even colleagues, families, and I think what we're going to do is kind of look at some of these questions and really get a sense of what people have as apprehension maybe of the vaccines, and really answer some of those questions. So Dr. Goodale, have you been part of this whole vaccination campaign here in Sudbury?
I have, yeah. So been vaccinating people at HSN and at some of the public sites. We're actually doing a big clinic tomorrow at Countryside for maybe up to 2,000 of our patients doing Pfizer tomorrow. So yeah, we're pretty excited about that. So
is that a walk-in tomorrow also?
No, so tomorrow I think Countryside does have a walk-in tomorrow,
okay.
But our side is really for the patients that belong to the family health team. So yeah, those are pre-booked appointments already.
Pre-booked appointments. And right now, I think the government has pretty much told everybody that's 18 and up, they can book their second doses. So it's good. Apparently it's going pretty well. So and I'm pretty happy with the numbers we're seeing in Sudbury so far.
Yeah. And the walk-ins have been working really well. My husband went on Sunday and was home within 30 minutes. So, was able to get it very quickly. So it was great.
Yeah, I went in on Friday. It took me about an hour and 15 minutes. Yeah. But considering the number of people that were ahead of me, it went pretty well. So.
Yeah, very well organized.
Very well organized. So very good. So let's start with our first question. Again, I collected these questions, over the last few weeks. And this first question is obviously about, a mother expecting their first child. So it says, I'm expecting my first child. Should I be concerned about getting vaccine? Will it affect my baby? Should I get vaccinated? That's a question I've heard quite often, and it's a legit question, because obviously, some of these vaccines are newer than others. The technology is a bit newer. So what would you say to a person that might have some of these concerns if they are pregnant or, will be expecting real soon?
Yeah, I mean, I think it's important to ask this question. I mean, every mom wants to do the best for their baby. Certainly the, NACI, so the National Advisory Council for Immunizations, and both the Society of Obstetricians and Gynecologists of Canada have recommended that all pregnant and breastfeeding women should get the vaccine. unfortunately, they weren't included in those initial studies because I think, that they were focusing on, mass populations and so forth.
Mm-hmm.
But we've been vaccinating thousands and probably millions of pregnant women and breastfeeding women, and really have not seen any increased risks in that group. And if you get COVID when you're pregnant, even though you're young, you are likely to have mild disease, but you are at higher risk than your peers of the same age. We say the same thing with influenza. You're at higher risk of serious infection. And so, in order to protect yourself, protect your baby, because your baby can't be vaccinated when it's born. So then if you got COVID afterwards, if you're vaccinated, that would be much less likely. And so you'd protect your baby as well. And it reduces your risk of, preterm labor, baby needed to be admitted to ICU afterwards. Those are some of the consequences if you got COVID in pregnancy. So, I think really important to be thinking about that.
Yeah. So the thing though, if you do get vaccinated while you're pregnant, I mean, your body is going to produce the immune system, the white blood cells, and it's going to produce antibodies that will protect, the youngin that's being developed inside of you. So it's important. And then again, just correct me if I'm wrong, but also in the breast milk, right? The mothers will continue providing some type of protection to their young one.
We think so. I mean, again, I think it's early days for that, but there is some, we do think that is the case. And we do vaccinate women in pregnancy we vaccinate them for influenza and for whooping cough. So vaccinating in pregnancy, when it's not a live virus, is not an uncommon thing. So
you would recommend that all pregnant women get vaccinated and protect themselves, and also would protect their young one. Unfortunately, COVID can make people really sick, and you don't only get sick when you're pregnant. That's right. Can happen. So, okay, good question. So that's a recommendation. Don't be worried about it. And some people are worried that the vaccine might affect the developing fetus. Is that the case? Will the vaccine change the way that the fetus will develop?
So there's no evidence of that. We worry. People have lots of questions about this mRNA vaccine, but it doesn't integrate into your DNA. It doesn't change the baby's DNA. There's no evidence of any kind of health, fetal defects or anything like that. If you get it in pregnancy.
Okay, good to know. All right, let's move on to our second question. So since the disease does not affect children that much, and there's a chance that my child might react badly to the vaccine, why should I vaccinate them? So I think that stems out of the idea that COVID-19 does not affect, young people as much as older individuals. And I guess this person's a little bit worried about the vaccine. So it's a good question. Why should we vaccinate young people and children?
Yeah, I mean, you're right. For the most part, children are certainly not affected as much as adults are, especially seniors. But some children do get very sick. So certainly to protect from that. I think as well, when I think of, I have 2 kids myself, and who I have quickly vaccinated. But when we think about everything that they've lost this year, when numbers go up, and for me, the mental health aspect of the COVID pandemic has had a huge impact. And I think if for any reason, if we can reduce numbers in our communities, and that includes vaccinating children, unfortunately they don't get sick, but they can spread this virus if they get it. And that increases our numbers. And that's when we see more lockdowns or the cancellation of their activities, online school. And I'm sure, like probably everyone watching, we want to get back to a lot of what we were doing before. And it's like, especially for kids, like this has been incredibly hard. I know kids are really resilient, and for the most part, we think they're probably doing quite, reasonably well, but we're seeing it in all kinds of ways, and we're seeing more depression. Eating disorders are have just increased dramatically. And, I think from a mental health perspective, I feel like we need to vaccinate kids to get the numbers down and to start opening back up and getting their life back to normal.
Yeah. No, I have a daughter, and there was a scenario, and she reacted very negatively to the scenario, a lot more than usual. It was just a little thing, and I think that was a symptom of what we're seeing with mental health issues. That she can't go to school, can't see friends as much, doesn't have that interaction. And let me tell you, she's like the first one saying, if I can get the vaccine, because she's younger than 12 years old, she's ready to get it once that gets approved for that. So we're looking at vaccinating children because it will protect children, because obviously some children do get really sick, not as much as seniors. So that does happen. And I mean, that's the truth. We don't want them to spread it to other individuals. So that's the other thing. The other thing I would also point out is that we're hearing about these variants of concern. We got 4 right now. And one of the reasons that these variants happen is because the virus has a chance to replicate in people. So people, when you get lots and lots of people getting sick, the virus has a chance to replicate, and mutates, it changes, and you get these variants. Well, by vaccinating the children, you're stopping the chances of of new variants appearing in children. And you know what? We don't want that. And as much as this individual said, it doesn't affect as much as adults. I mean, we had a situation in Northern Ontario. It was a community where there was an outbreak, and the chief said, there was a bunch of kids that got sick. They got really sick. So it does affect young people, and we got to be aware of that, And right now, the vaccines for 12 and up, the Pfizer one that's been approved, it's been great. It's been great. It's been protecting. It works. It works really well against young people because they got that great immune system, that they're young and the immune system is ready to go. So it's great for them to get
absolutely. That. And I think if they do get sick, then the whole family also needs to isolate. Now, I don't know what's going to happen once, everyone's double vaccinated, what the new rules will be for that. But it does have an impact on the whole family as well. So, yeah. Yeah,
that's a good point. Okay, thank you very much. So next question. This is another good one. So the individual wrote, so I read that vaccinated people can still catch and spread COVID-19. I understand the vaccine protects those that take it, but I don't understand how it protects those around us. Would it be better for me not to take the vaccine so that I know when I'm sick, and then I can isolate myself as to not spread COVID-19 to others? So from the gist of this question, what this individual is trying to say is that the vaccine, people that are double vaccinated, the double dose here in Canada, could potentially still have COVID-19, could potentially still spread it. So wouldn't it be better not to get vaccinated so I know when I'm sick, and then I'll just isolate and, decrease the chances of me spreading to others? So there's a lot of different ideas and
layers there.
How would we respond to this?
I mean, first I would say, number one, you're much less likely to get sick if you were vaccinated, right? So right then your chances of transmission are significantly lower. There's still a lot that we don't know yet about transmission with regards to post-vaccines, but certainly early studies have strongly suggested that there's a significant reduction in transmission, even if you get sick. It reduces your total viral load in your nasal cavities, which is how this is spread. The higher the viral load, the more likely you are to spread it. So
when you mean viral load, it's the number of viral particles.
Yeah, exactly. Yeah, exactly. The quantity of virus that you would be carrying. And so if you're vaccinated, you may still catch it. It's still less likely. If you do catch it, you're less likely to be very, very sick from it. In fact, very unlikely to be very sick from it. I mean, that's the main point of the vaccine, right? Is to reduce serious disease and hospitalizations and death. If you, and then as well, if you're not getting sick, you're not transmitting it. You're less likely to have asymptomatic disease and transmit it. So we do see asymptomatic disease in people who are vaccinated, and they're transmitting it. And that, when we were in Sudbury, we were seeing a ton. When we had our numbers really high in February, there was so much of that. I was working at the COVID center, and we were calling people who were positives, and there were lots of people who had no symptoms, but everybody in their family also had COVID, right? So there was lots of asymptomatic transmission. Whereas we know when you're double vaccinated, even if you get it and you're asymptomatic, you just happen to be tested, you're less likely to pass it on.
Okay, so So the idea of the individual saying not to get vaccinated wouldn't necessarily help, because they could be that individual's asymptomatic and unintentionally spread it to,
That's right.
to others. At least if you're vaccinated, the chances that you spread it to others is much lower, because your body's not going to, well, the virus doesn't have that opportunity to really produce lots of virus to release out there. And the thing is, the reality is when these vaccine manufacturers test these vaccines, they're not testing whether or not you're going to release virus. They're testing whether or not the vaccine is going to protect you against the disease. That was their initial, testing process. But as more research is coming along, they're probably going to demonstrate that that is the case. You're not releasing as much virus, because all the other vaccines, pretty much that's the way it works, right? You get a whole bunch of people vaccinated, whoop, the disease goes.
That's right. Exactly.
And one of the reasons for that is that people aren't spreading the disease anymore. It's just like, oh my goodness, it's just stopping, right?
That's right. You're not getting sick. That's right.
They're not getting, well, it's not just they're not getting sick, they're not spreading it to individuals. And a good example of this, just again, I'm kind of rambling on here. We heard about a month and a half ago, there was the New York Yankees. There was like 8 personnel members that had been tested for COVID-19, and they were fully vaccinated. Now, keep in mind, because they're athletes, they get tested all the time, right? And 7 out of them weren't showing any symptoms. The 8th one had very slight symptoms. So the vaccine did work to prevent them to go to the hospital. And the one of the doctors, I'm not sure if it was a team doctor or another doctor, kind of mentioned is he was really doubting that the virus had spread amongst the vaccinated people. He surmised that an unvaccinated, probably asymptomatic people, which was spreading, that person was spreading a lot of virus, had infected those individuals. So I think the rule of thumb is, please get vaccinated. You're decreasing the chances of spreading it to other individuals. And frankly, it doesn't mean because you're not vaccinated, doesn't mean you're even going to show any symptoms. And then potentially you might infect other individuals. So, yeah.
And some people who've had COVID have long-term symptoms as well, right? So, there's some people who were very sick early on, still months, and we suspect maybe even for years in some unfortunate people that may have chronic fatigue, shortness of breath, limited exercise capacity, things like that. So that's important. And on top of that, we still recommend that if you've had COVID before, that you should be vaccinated, because we're not sure how long that immunity will last. We're not sure either with the vaccine, but we do think that it's a better immune response than it is having, gotten COVID in its wild form, I guess you could say.
Actually, it just came out in the news recently that the mRNA manufacturer, I think it was Pfizer, it could be Moderna, I'm not quite sure. They are now looking at the individuals that they had in their stage 1 and stage 2. So when you try out a vaccine, and they're looking at their immune system, including antibody levels, to see how those levels are. And so far, the indication seems that they still have high levels of immunity, even after a year that the vaccine was administered to them. So it's looking good. It's not to say we might not need booster shots. Who knows?
Yeah, we don't know.
It's looking good, and it's the best tool that we have to protect oneself. So the person who sent me that question, thank you very much. It's a good question, because you can tell the person thought about it and was like, okay, why if I'm still going to... But frankly, you decrease the chances of infecting others, and doesn't mean that, you will even show symptoms if you're not vaccinated. So you know what? Don't take a chance. Please get vaccinated. Just for audience members that are listening to this, if you have any questions, please write them down in the chat, and we'll try our best to answer them. So we'll go to our next question. So Renee will pull out. Okay. So how is getting vaccinated as a parent beneficial to my child when they can't themselves be vaccinated yet? So I'm assuming a child that's under the age of 12, like my child is 9 years old. So why is it beneficial for me to get fully vaccinated when, my daughter can't get vaccinated?
Yeah, I think, the same reason that we recommend vaccinating, for pregnant women against whooping cough and influenza and so forth. If you're vaccinated, you're less likely to bring that virus home to your children, and we saw that with the outbreak in Sudbury, right? We saw a lot of young children who really didn't go anywhere, right? So they were clearly getting this from their parents. And so you reduce the chances of passing this on to your children. And as well, it's really hard to take care of your children and take care of your family when you are sick. And some people are quite sick with COVID. And so less chance of severe disease as well, if you're, when you're vaccinated. So.
Yeah, and I've heard, from our health unit, and other, medical officers, when they also looked at, what was happening in schools, in these outbreaks in schools and kids getting outbreaks, it was a reflection of what was happening in the community, right? So if community cases started spiking up, then you would see those in schools, and then there was more school closures and quarantines. I know I lived through 2 quarantines, the whole thing, right? So I think getting as many of the adults and 12 and up vaccinated will decrease the amount of community spread, and that will be also a reflection of what we're going to see in school. So I would also say, getting yourself vaccinated will also give a better opportunity for your child to return to in-class learning, to return to a normal class life. They're probably still going to wear masks and all that, but at least we're giving them a better chance at doing that than if we're not vaccinated. So it is true, they can't get vaccinated right now. It will be soon, hopefully, but it's important that, if we decrease the number of individuals that could potentially get sick, then the children will be better protected, and hopefully we'll be going back to school to something a little bit normal. I noticed there was a question by Kirsten. Do you want to address that?
Yeah, so the question from Kristen was about timelines for when children under 12, she's referring to the high risk group, but any children under 12 will be able to receive the vaccine. We don't know. I feel like that's an answer we give, if we had this talk next week, we may have an answer. Things are changing so quickly. But right now we don't know. There are studies underway with Moderna, Pfizer, Johnson & Johnson, I believe starting at the age of 6 months, looking at vaccinating and how effective is it and risks and so forth. Unfortunately, they weren't included in any of the original trials. I think rightfully so, because we wanted to get this out relatively quickly. But they're certainly ongoing, and I'm sure as soon as it is available, you will hear about it on every billboard and Facebook post and so forth. I think it will be just like it was for the 12 and 12 to 18-year-olds.
12 to 18. I've heard, if everything goes well, I was reading a Pfizer report on this, they're hoping by fall to come up with some type of result. But keep in mind, it doesn't mean because Pfizer has something out in fall that Health Canada will jump on it and say, okay, we're ready to go. Health Canada still has to review the data, has to confirm things, have to make sure that everything's kosher, that, the processing, the manufacturing, everything. I mean, it's not going to change that much, but there will be probably some. So it still could take a while before Health Canada approves it. And that's just being prudent. That is just being prudent, making sure that, that the vaccines are going to be safe and effective against, young people. So, I've heard some, top scientists and medical officers looking, maybe, again, don't quote me on this, but if you're looking for a time at the end of this year, beginning of next year.
Yeah.
So I've been telling my 9-year-old that maybe her Christmas present might be a vaccine. She wasn't too happy with it. But anyways, so don't think that. I really doubt that we're going to have a vaccine ready for before or at the beginning of this school year, September. I don't think that's realistic, but most realistic at the beginning of 2022. I think that is realistic. So you know what? Hopefully by the first quarter of 2022, we're going to have kids fully vaccinated. So anyways, keeping our fingers crossed.
Yeah.
Like you say, Natalie, that's science. We're learning things all the time. And I know with children, and people say, wow, children, aren't they just little little dose. No.
Oh, no.
That's it. You have to treat them as a completely different group, and the dosage you give them is going to be different. And their immune system, we're saying 12-year-olds, they have a great immune system. Wow, many younger ones have even a better immune system. They react a lot more. So you have to make sure that, we're giving them the right amount and that the vaccine will work for them really good. So anyway, so that answers hopefully your question a little bit, and hopefully soon. We'll get something for the little ones. All right, great question. So let's go to the next one. I'm going to change. All right. So I heard that young people, after getting the Pfizer vaccine or an mRNA vaccine, can develop myocarditis. So what is it? And should I be concerned for my 15-year-old son? Good question. That's really topical.
Yeah, very topical right now. I feel like this could be my question because I have a 15-year-old son. But what myocarditis is, it's an inflammation of the heart muscle. And common symptoms include chest pain, difficulty breathing, feeling like your heart is beating very quickly, or like a fluttering sensation in the chest. So there have been case reports of myocarditis following the vaccine. However, right now in Canada, the cases of myocarditis are no different. The amount of cases that we're seeing are not any higher than what we would normally see. So as of Friday, I think there's been 29 reported cases of myocarditis. And
in Canada?
In Canada.
In Canada, okay.
And there's been 13 million doses given of Pfizer. So, I think
for young people.
Total, because you can get myocarditis at any age. It's not just young people. It's more common in young people.
Okay.
It seems to be more common in boys, and more common after the second dose.
Okay.
So obviously this is an area where, we want to watch for this. There's some countries that are further ahead than we are with regards to vaccines. We've given a lot of our, most of our 18 and under have received a first dose, but not a second dose yet. Whereas in Israel and in the UK, they're certainly further ahead. They are seeing slightly higher amounts of myocarditis, but again, they're not sure if it's a direct link to the vaccine. So this is because it's such a rare side effect. They're not sure. It was never found in the initial studies because you need to give it to millions of people to be able to find it, right? So when you have these rare events, you often need to, it's more in real life data that you'll find these things. So
just to give people perspective, when they did these trials for these vaccines, I'm talking about the 4 of them approved, they go through the same step. There's a stage 1, stage 2, stage 3, and they vaccinate a whole number of people. Stage 1, a few tens of individuals. Stage 2, about 1,000 individuals. Stage 3, tens of thousands of individuals. So give people just a perspective. For the 4 vaccines, they tested these vaccines on over 100,000 individuals. Okay, so maybe the myocarditis didn't really appear because it was 100,000, individuals compared to 26 million or millions of millions.
Yeah.
So yeah.
So the CDC, Health Canada, the WHO are all watching closely to see if there is an association with this. The cases that have occurred have been mild, have resolved with, some anti-inflammatories, some rest, and the people have recovered in the majority of cases. So I think right now, we don't know for sure. We know that you can get myocarditis or an inflammatory reaction if you get COVID as well. And so, I think that's important to remember is what is the risk if I don't do it either and you get COVID? There is still that risk there as well. And so, I think for some people, this is causing a little bit of a pause. I know for me, I'm hoping to get my son vaccinated as soon as possible so that he can get back to, to be protected. But I think this is something that you need to be aware of, and ask questions. We don't have a lot more information at this point, but something that's certainly being watched.
Okay, just to give people perspective, I had read a report just last week. So in the United States, 26 million individuals between the ages of 12 to 18 had the Pfizer vaccine, and a branch of the CDC, one branch that looks at the effects, I forgot, reported just over 320 cases. So we're not looking at something very high. In Israel, I think they had over 5 million and just barely over 200 cases. And as you mentioned, they recover. They're young. A lot of times they're young. They recover. If they have to go to a hospital, it's an inflammatory, they're in and out like 24, 48 hours. Most of them, they recover at home, chill, just watch TV, do something, calm, and just be aware of that. But obviously, if you are concerned, or if, your child, chest pains, like what's going on, and also that, what, go to the hospital.
Yep, that's right.
Let them know that you've had that. They'll keep an eye on them, but the chances are really, really low. And, because they're young, they recover pretty quickly from that. So for a parent that says this, you would recommend, get the vaccine, because the chances of something really bad happening for getting COVID is much higher than the vaccine.
That's right. Yeah, that's right.
And you have a 15-year-old son, so he's got at least his first dose. So it's good to know. All right. So next question. Do we have any other questions from the public? Not yet. So if you have any questions, please write them down in the chat. Okay, we're going to go to the next question. Good job. All right. Okay. So how can I reassure my child that the vaccine is safe? So I love this question, because I'm thinking that a lot of parents assume that the child is willing to get the vaccine. And I think this is a really good question, because I think we need to have a discussion with our children before, we decide to bring them to a vaccination center, because
or not,
right? Depending on what the issue is. But to assume that your child, has no questions, no hesitancy, is ready to go, may be a little premature, because I've seen it in the news where some children were like, oh, I'm not too quite sure. So how can we reassure our child that the vaccine is safe?
So, I think, number one, I think schools have done a great job. Like, when I look at what my kids have learned about COVID through school and so forth, I feel like kids, especially in that age group, are pretty well informed, and they have so much access now to social media and just, anything they want really on the internet most of the time, that they have lots of information. So I think, number one, you want to try and answer questions in a really open format. If you don't feel comfortable answering those questions, then making an appointment with your healthcare provider, either in person or, we're doing lots of phone and video appointments now. So having that discussion if they feel that they have some specific questions. Starting by asking them what they already know about the vaccine. I mean, that's my approach, right? When somebody starts asking me questions, I want to kind of know what's their baseline, where are they coming from, what have they read, what do they understand about COVID, what do they understand about the vaccine? Because I think you need to be able to understand both. What's the risk of doing something and what's the risk of not doing something? And, and in Canada, there's no age for consent. So a 12-year-old can refuse the vaccine, just like a 12-year-old whose parents don't want them to have the vaccine can actually have the vaccine, right? So as long as they understand kind of the risks and benefits of both sides. And thinking about those outside pressures, right? What the parents are wanting, what they're, what the school, or if you want to play hockey, you need to get vaccinated, these kinds of things, so there's some outside pressure there as well. And then, share your knowledge, offer to tell them what you know or don't know about the vaccine. There's lots of great information on, I think, the Sick Kids website. I was trying to think, I downloaded some things, CDC, but the Health Canada as well. They have some really nice documents with questions and answers that are pretty easy to go through. So you might be able to get the information that you need there. And if they have a very specific concern, like, you don't want to inundate them with a bunch of information that they don't really want to know about. So try and answer their concerns specifically. And often that's all that's needed in order to, either reassure them or give them the information that they need to make their informed decision. And then maybe even talk through a specific plan. So if they do want the vaccine, okay, well then what's next? Where would they go and make an appointment, or where could they go and go to a walk-in to get the vaccine as well?
I would just add one thing. You talk about social media, and we did a kind of a webinar on this for seniors, but it affects everybody. There's also a lot of misinformation, incorrect information. So maybe the other thing also is if your child is mentioning certain things that they picked up on social media, it's maybe kind of look with them where they're getting information, kind of let them know whether or not the information is correct. Is this a good source? Here's a better source with that. Just so that they understand that, everything that they see on social media is not necessarily the best information, because
That's right.
Facebook is not a doctor, right?
That's right.
TikTok, definitely. But there are lots of doctors or lots of medical professionals on TikTok, on Facebook that are providing really good information. You just have to be able to navigate and see what it is. And also it all depends, where are they getting their information? Is it from a friend? And unfortunately, share misinformation unintentionally. So I think you're right. There's so many different aspects with them. And like you said, have a nice conversation with them. And as a parent, if they ask you a really good question you just don't know, talk to a doctor, talk to a nurse, healthcare.
Or a pharmacist as well, right? They're very accessible as well. So
or look it up on like the Health Canada website. If there's information on the local health unit, they do have lots of information on there. That's the best way. And I find also for young people, maybe they feel a little hesitant and things like that. If one of their friends has had the vaccine, maybe have them part of that conversation and see, how did they feel about getting the vaccine, and maybe having that discussion peer to peer might help them make a decision whether or not they wish to be vaccinated. So may be another thing that you can do, but please have that conversation before bringing the child. Well, you don't know. You don't want to end up there, and this child is sitting there and ready to go. And the child's like, "No, I'm not doing it." It's like, we made the appointment there, but please have the conversation beforehand so that you don't get into that situation. All right. So next question. Oh, I love this one. How do we know that in a few years people won't be having major side effects from the vaccines? And that's something that I will say certain groups of people keep harping and kind of dissuading other groups of people for not taking the vaccine. So somebody asked you that question. How would you respond?
So the first thing, we're so lucky in Canada because we have had vaccines here for so many types of diseases for, over 70 years. And so we have lots of experiences with all kinds of vaccines for which we don't see any long-term negative effects. So, I think for me, that's really important. As well, the other question that I often get associated with this was, this was so fast. This came out so quickly. How do we know? Because it was so fast. And most vaccines aren't developed this quickly. And that's true. Most vaccines are not developed this quickly, but this was unprecedented. The collaboration that occurred worldwide in order to get these vaccines, usually you have a small group of people at a drug company working on a vaccine and whereas this was, worldwide 24/7, where they were really working to find a vaccine and then starts the studies right away. And, usually what Health Canada would do is once they have all the studies done, then they would send all that information and Health Canada would review it. Whereas this was sort of a live, dynamic process where Health Canada was staying on top of all the results of these vaccines so that when those trials were done, they already knew the information that was in those documents and could make a decision relatively quickly. So, for me, the long-term effect, just given our experiences with vaccines, for a whole multitude of diseases for which we don't see any long-term effects is very reassuring to me. Mm-hmm. And we do know that if you get COVID, there are long-term effects for some people as well, which can be debilitating, where people can't go back to work or just enjoy, the activities they used to enjoy. And so I think that's really important to remember as well.
And other vaccines that have been developed, just to give people perspective. So what happens, you get the trial groups or the people who get vaccinated. If there's any long-term effects, they usually appear, a couple of weeks to a maximum about 8 weeks after. That's usually it. If you're going to see a long-term effect, it appears within that 8-week window. And frankly, Health Canada and many health agencies only approve vaccines almost like 6 months after that. We're giving ourselves such a big buffer to really, really make sure that these vaccines don't have long-term health effects. Now, there is one long-term health effect with this vaccine. It does protect you against COVID-19. So we can say to people, there is a
positive health effect. Exactly. They're not always negative.
But it's a long-term health effect.
That's right.
You give people an idea of how quickly this vaccine, and you say, oh my goodness, this was done very quickly. So many companies involved, but there was a lot of money, right? Governments were just throwing them money, say, do this, we'll pay for your doses right off the bat. So they didn't have to go back to the shareholders and say, we're going to do this. No, they had the green light to develop this as quickly as possible. And just to give you perspective, how as a society we can do things quickly. When I was young, there was a Jehovah's Witness temple, synagogue, I'm not sure what to call them, that was built not too far from our house. So they laid down the pad, and the cement pad was there for a couple months. It needs to cure. And they built that structure in 24 hours.
Oh my God.
And the way they did this, and I just want you to think of a vaccine. So as the carpenters were putting up the walls, they had inspectors making sure everything was done. As the inspectors were going on and signing off and everything, the electricians were going along. And then the plumbers. And then there was other inspectors to make sure it was going on. And then they started putting in drywall and painting. They had sheer number of individuals. The inspectors were there. So no steps were skipped. They just were going one after the other, and they were able to build that building in 24 hours. And you could just think a house takes, weeks and sometimes a couple of months. Well, they were able to do it in 24 hours. So now just imagine when it came to this vaccine, there were no steps that were skipped, but some of the steps were kind of overlapped with one another. And as you mentioned, Health Canada received the data as it was coming in, so that when the last data came in, they didn't have to analyze all that data at once and digest it for months and months and months. They can make a decision relatively quickly. But it is still amazing that we have a vaccine in under a year that is safe and effective. That is just mind-boggling.
Yeah.
And keep in mind that we already knew a lot about the vaccine, that the technology, that the mRNA technology allowed us to build and develop this vaccine much quicker than other vaccines in the past. So it's a combination of our previous knowledge of this kind of coronavirus. We had SARS, right? Beginning in 2000.
Virus,
So we had a lot of information about that. The coronavirus that we're fighting right now is somewhat similar. Plus this new technology that, as much as I say it's new technology, it's been developed over 15, 20 years. And it just was like convergence of everything at the same time, which allowed us to develop these vaccines very, very quickly. So they are safe. And the only major side effect, it protects against COVID-19. So you can tell people one major side effect, it protects you against COVID-19. So that's true.
That's important.
That's important. All right. Does anybody have any questions? I'm not seeing too many questions from our audience members. If you have any questions, please add them to the comment section. So we're going to go to our next question here. I love this question also. This was especially at the beginning, and I still get that question, So the vaccines use genetic material of the virus. Okay. Now they build this genetic material in the lab, right? So just so everybody know. And it goes into our cells so that your cells produce components of the virus, which is the spike proteins. We hear these spike proteins. Okay. So the question is, will this vaccine change my DNA? And then a question about, will it affect my ability to have children? So will it affect fertility? I'm hearing that quite often. So let's answer the first question. Will it change our DNA? Are we going to start growing spike proteins all over us, or change and become something else at the beginning of Planet of the Apes or zombie apocalypse or something like that?
Not that we know of, no. So, no, it's showing you a piece, like you said, of a spike protein, of one of the proteins that's on the virus, right? It's just showing you a piece of that so that your body then makes these antibodies, which are the cells that protect you from getting an infection, right? So that's what it's doing. If you got coronavirus, you would be exposed to tons of these spike proteins, hundreds of them, whereas this is presenting you only a very small amount. So it doesn't go into your DNA, and just like any other vaccine that we give, it does not affect fertility or affect your ability to have children, or like we mentioned earlier on, if you're pregnant, it does not inject itself into the baby or anything like that.
So it doesn't go. So just sort of for people, if you remember your cell biology in grade 8, oh my goodness. So essentially the component of genetic material that goes inside the mRNA is only a small portion of the whole blueprint of the virus. And that portion will direct your cells to produce those spike proteins. So that's really neat technology, because in the past, when we produced the vaccines, we'd have to grow these spike proteins in these vats. And there's some vaccines being produced that way, grow in the vats, and then you purify the spike protein and then injecting you, and then your body builds. Well, we're kind of skipping all that. Your body's actually producing those spike proteins. So it's only producing that, and then your immune system will attack it. And then if a real virus comes in, recognizes the spike protein, hey, you're not supposed to be here, and gets rid of it. Now, what's really neat with mRNA, it only stays inside your cell for about 24 to 48 hours. Your cell will actually eat it up, get rid of it. So it doesn't even stay. It's not even permanent inside of your cell. So a lot of people think, it's going inside your cell, it's going to change. No, it's just the way the biology is of mRNA. It doesn't even go inside the DNA. It doesn't integrate within the DNA. It only stays for 24 to 48 hours. I've had people sharing misinformation that, it causes your cells to produce all these spike proteins forever and so much. No, it's only for 24, 48 hours. After that, that's it. It's done. But it's enough for your body to build an immune system and the antibodies. And keep in mind, that's exactly what you said. These vaccines prepare your body for an actual virus, so it can attack the virus. You can get exposed by the coronavirus, but unfortunately you will get sick, or could get really sick with that. Whereas the vaccine, because it's only one component of the virus, it can't get you sick like the coronavirus. It just can't. It doesn't have everything it needs to make you sick. So it prepares your body so that if a real virus comes in, it can neutralize it real good. So you know what? You don't have to be afraid for it to change your DNA. And just by the biology, it can't affect our fertility. In fact, I think Pfizer did a study. Now, it wasn't a ton of men, but they did a study on men, and no, it doesn't affect their fertility. They were producing just as much sexual cells as before, and everything was hunky-dory. So, you know what? Don't worry about it. Please take the vaccine. All right, so let's check. Oh, here we go. Next question. So I heard some people get sick from the vaccine. Did the vaccine give them COVID-19?
So the easy answer is no. So this is not what we call a live virus. So there are some vaccines that we give that are called a live virus, where we're giving you the actual virus that's just not quite as infectious, right? But that's not the case with COVID. But yes, some people do get side effects after getting the vaccine, and common side effects typically last somewhere between 24 and 72 hours for the majority of people. I've heard anecdotally more with it, after people have had a second shot.
So what are some of these side effects? So you kind of mentioned that.
Yeah. So things like, the most common ones when you get any vaccine. So a sore arm, sometimes a bit of redness around that area as well. Some people will get fevers or chills in the first 24 hours, headaches, muscle aches, joint pain, sometimes swollen glands as well. And all of those typically resolve. Sometimes the glands will last a little longer, but the majority of them where you feel just kind of crummy. Some people will say they feel a little bit flu-ish, but they're not short of breath. They're not coughing. They're not being hospitalized. Sleep it off 24 hours, take some Tylenol, and typically things are better.
So again, correct me if I'm wrong, but from my understanding, if people are showing these symptoms, of the vaccine, from what I understand, it's really your immune system kind of doing whatever it needs to do in order to get ready to fight the disease. So I've been telling people that, if you do have some of these side effects, well, it's showing that the vaccine's working for you, that your immune system is doing what it's supposed to do to protect you. And you know what? Kudos to you. I know you're not feeling good for 24 to 48 hours, but you'll recover.
Yeah, but if you feel fine after your vaccine, like I did, you're still good. You don't need to be sick to know that it's working.
Yeah, it's working. So, when they say side effects and things like that, just keep in mind that obviously, if you have a fever of 42 degrees Celsius, go to the hospital. But for most people, that's not the case.
No.
They recover. I have a friend. He had AstraZeneca, the first dose. He got, I believe, Moderna, the second dose. And every time he gets a flu shot, every vaccine, he's out for 24 hours. He takes a nap. He feels it. But that's his body. That's his body. That's the way he is. Yeah, his family members they're fine. That's what it is. So I wouldn't get too concerned with this. It's just demonstrating that the vaccine is stimulating your immune system to get ready to fight a natural disease. So in a sense, hey, it's actually saying to you, you're on your way.
Be happy. Yeah.
So that's pretty good. And it does not give you COVID-19 because, as we mentioned just earlier on, it's only a small portion of the blueprint of the virus that goes inside you. It doesn't have all the information to create new viruses. So you're not creating new viruses. I've heard some misinformation out there. I don't know if you heard this, Natalie, is that some individuals think that a vaccinated person, because they're vaccinated, they are releasing either viral particles or vaccine particles. And I've never heard that. I've heard things like shedding or off-gassing. It's kind of weird. I've never heard that. And again, that's not the case. That's not how this vaccine works.
No.
We're not producing. But if you get COVID-19.
Yeah. You can't sit next to someone who's been vaccinated and be protected that way, right? Either that's not, you need to actually get the vaccine.
Yeah. And I again, that friend kind of mentioned this to me. He was telling me that a pregnant woman in this group who hadn't been vaccinated was debating whether or not to visit family members that were fully vaccinated because she was afraid that they would off-gas to her. I'm not sure what that means, and she could potentially get the vaccine or get sick. And frankly, it's strange because it was the other family members that were saying, well, we're kind of concerned you're not vaccinated.
Yeah, I was going to say,
sure
I'm more concerned about the reverse. Yeah.
That's it. Yeah. So don't worry about it. If somebody is vaccinated, first of all, they're protected, and they're not releasing anything out in the environment, because if vaccines work like that, oh my God, my friends that were vaccinated like months ago, I've been invited at the dinner parties.
Yes, exactly.
Like talk to them this close so that I would get vaccine. Probably it doesn't work that way. It's not an aerosol.
It would save a lot of money on vaccines, though.
Oh my goodness! Imagine you just need to vaccinate a couple of people, release them, and just say, "Have dinner parties, have dinner parties."
Yes, exactly. Go to the arena. Yeah.
Go to the arena and then vaccinate. No, that's not. So you don't have to be afraid. The vaccine doesn't give you COVID-19. And you won't release anything. You won't get anything from somebody who's vaccinated. So you don't have to be afraid of that. All right. Okay. So next question. Oh, we kind of answered this question already.
Yeah. Kristen was foreshadowing our.
Yeah.
Knew it was coming up.
Very good question. I got a 9-year-old, so that's my major thing. And again, once the vaccine does become available to the younger group, it's really important that we get them vaccinated, because we hear the term herd immunity, and they need to be part of that herd immunity. Can you kind of define to us what that term means? What does herd immunity mean?
So that a certain number of people in the community, a certain percentage, is vaccinated, which then reduces total rates of that particular illness and then prevents further spread, which is really what happens now with a lot of our vaccines. we see more and more certain groups of people who don't want to be vaccinated for our routine immunizations, right? And the reason that those people aren't getting mumps or measles or rubella or meningitis or these kinds of things is because the vast majority of the people around them are vaccinated, right? So, fortunately, if you have the vast majority of people that are vaccinated, you will protect those that have chosen not to be vaccinated or that cannot be vaccinated, right? So I think it's important to remember that, herd immunity is really important for people who, because of immune system, because of cancer, because of various issues, they cannot be vaccinated. And so that's where herd immunity is really important.
Yeah, and I've done kind of fun Kahoot sessions with 12 to 17-year-olds in the past month because and I've had a lot of teachers wanting me to do this, and I had a lot of good questions from 12 to 17-year-old students. And one question was like, well, why is it important for me to? And I said, it's important for you because you are one of an important group to have this herd immunity, and you guys are even more important because we know, because your immune system is so good, that once we give you the vaccine, the chances of you getting sick and spreading it to other people is probably even lower than other age groups. Like, so individuals that are a bit older, their immune system may not be as good, right?
Yeah.
So you guys are really a good group to protect everybody else in our population, so that you don't accidentally spread it to others. Or if you come in contact with somebody that may have COVID-19, you won't pick it up and then spread it to somebody else. So that's important. So even the little ones, it's important to include them as part of this equation. So keep in mind, the term herd immunity kind of sounds strange, right? And the term came out because it was a term that they gave to cattle. They were immunizing cattle, and they said, wow, there's this herd immunity, and we kind of use that term. I think the term they like better to use is community immunity. If as a community, we have most of us that have been immunized, hopefully through vaccination, this will help prevent the spread, because then we break the chain of transmission, right, from one individual to the other. And as you just mentioned, it will protect those individuals that, unfortunately, for whatever reason, the vaccine doesn't work, because the vaccine may not work with other individuals that can't be vaccinated. So anyways, it's one part. We all play our part. And if we all play our part in getting vaccinated, in doing all this, we'll all protect one another really from this disease. And unfortunately, the little ones can be vaccinated right now. So it's even more important for those that get vaccinated that we get vaccinated, so that we can protect the young ones, so they can go to school, that we can have a more normal life and protect them as much as possible. So anyways, so that's a really good question. It's a really good question about, when to get vaccinated and herd immunity. And you know what? We all need to do our part. And if we could all do our part, then it's important to stop the disease, because eventually we want to go to whatever new normal is going to be, right? And keep in mind that, we're talking about people getting the double dose. I got my double dose. I believe you got your double dose, right? Yeah. And I got questions like people, well, why do I still need to wear a mask? Why do I need to do all these health measures? Well, we got a portion of the population that haven't been vaccinated yet. So we still have to follow these, guidelines to protect them. And then once they're vaccinated, then we'll be in a better position to think about removing, the mask and doing what we used to do in the past. And I'm pretty sure when that day comes, you'll be one of the first person that will be telling people, yay, we've done it. And then
I think it'll be very weird, though, to go somewhere in a group without a mask on for a long time for a lot of people. I don't know that I'll ever work again without a mask on, even in my office. So I think there's some new normals that have occurred as well.
And I think it may change. I know they have done a survey with people, and they said, would you, ditch the mask? And it was, I think, up to 30% of people saying, in some settings, I think I keep the mask, like riding a bus or a train or something like that. So people might still feel as if they need to continue wearing that even after the pandemic is done. And keep in mind, ladies and gentlemen, that even though the pandemic or the disease might be under control here in Canada, eventually we'll be under control. We still have the rest of the world, right? So as much as we may think, okay, we're done here in Canada, I mean, there's many, many other countries where the vaccination campaign hasn't started, and we need to ensure that everybody in the world, if they can vaccinate and wish to get vaccinated, they get it, because that's how we're going to be able to stop the pandemic. So thank you very much, Dr. Natalie Goodale. Thank you very much for your insights with this. Do you have any last message, words you want to share with people?
Just, check out the public health website for any clinics that are coming up. Please get your second shot. I think we're all happy as we're, advancing through the various stages in the province, and we want to continue seeing these low counts and low death rates and low ICU admissions. I mean, that's great. Those are great signs that the vaccines are working.
Yeah, and hopefully this session, will have given you at least more information, and that you can use that information to make, the most appropriate choice for yourself and your family. Okay, so I'm hoping, and again, if you have any questions and you want to speak to a medical professional, please do so. All right, that's the most important part with all this. All right, so ladies and gentlemen, thank you very much to have joined us, and thank you very much, Dr. Natalie Goodale. And hopefully, you have all the information so that you can make an informed choice on what next steps you will do, whether or not it will be vaccinating or maybe not vaccinating right now. But please, any questions, talk to a medical professional. All right, have a good evening, everybody.
Bye.